Emily, please, will be presenting on gender gap in health outcomes.
I'll go ahead. Hi, everyone. Welcome to my presentation. The topic of presentation is on gender gap in health outcomes among the working age individual. And since my broader thesis topic is on climate variability and health, I try to check if weather effects play a role. This is one of my thesis chapter still in progress. I don't know why it's not moving. Okay. I will start with my research questions. Just a moment, yeah. I'll start with my objectives. Is first to assess the effect of weather variabilities and healthcare services on men and women health outcome, and then establish the gender health gap, quantify the contribution of weather variabilities and healthcare in explaining the gender health gap. Going forward, I will follow the guideline of the questions that we were given to answer those questions. And the first question is, what do I understand by the word gender in my project research? So for me, gender goes beyond biological sex difference and incorporate factors such as economic and social and institutions that affect, influence, and define men and women. In my study, apart from using the sex variable, I incorporate other factors such as income access, social status, employment, access to resources, and health services. And also I focus on both men and women because some of the gender factors and the associated inequalities affect men and might be detrimental to men's health as they are to women's health. Right now it's actually common knowledge that women live longer than men. And on the other side, women live longer, but then they live sicker lives. So there are already these established inequalities, and it will be good to look at both sexes together. I also focus on a subsample of the working age category because it's an economically active group and where gender aspects such as norms, acceptable codes of conduct have already been learned and need to be adhered to. Actually, they are monitored by either peers, parents, and communities. Some people say by age 10, yeah, someone must have learned this. So this is just a basic background on how gender affects health. Myself, I'm not a health expert, so it is also a good background for other people as well. The World Health Organization already recognized gender as a social determinant of health, and there are different pathways through which gender or gender inequality is translated into health risk. And this is differences in vulnerability exposure to injuries, diseases, and disabilities, and also differences in health behavior and healthcare access, biases in health system in terms of division of labor financing, as well as health research. All of these things are usually dictated by gender norms, discriminatory beliefs, and values. For instance, now gender roles determine where men and women spend most of their time and might be a major determinant of exposure to infectious diseases. And also the different role, for instance, multiple roles of women in reproductive, domestic, and productive activities, caregiving roles, breadwinner roles on the part of men, risk-taking roles on the parts of men, and masculinity are all sources of risk. And climate or weather extremes have also been recognized as a gender-based health inequality risk multiplier. So what are the dimensions, gender dimensions in my project design? I try to look at the different factors at different level, individual household that could possibly affect health of men and women, either directly or indirectly. Okay, the factors such as education, that are already known, also inequalities in health access, curative as well as preventive, and also differences, exposure to sensitivity and sensitivity to weather variabilities, and the health inequalities in terms of illness. This is my main outcome variable. So who benefits, who loses, and who has access to resources? These are some of the descriptive statistics that will answer that question. And as we can see from this table, I try to provide the total sample, women, men, and the difference. And as we can see, education, for instance, we see the difference between men and women is not quite so much. Actually, women are trying to catch up, with men in terms of education, given that this is also secondary data, and data was collected like almost more than 5 years ago. And in terms of occupation, we see that men actually, they are more involved in paid work as compared to women. For instance, you see 27.8% of men are salaried, while 86.5% of women are in farming, as compared to 80% in men. And in terms of income, I try to establish different categories. We see, of course, women, they dominate the lower categories of income. 87.9% of women, they didn't have income compared to 77. And income greater than 250,000 Ugandan shillings, we see more men dominating those income categories. We also have differences in marital status, and they are significant. Some of the variables were collected at household level, and we do not see so much differences like the asset index, the water sanitation, dependency ratio. We see women are in households where the dependency ratio is so high. So in conclusion, we say that there is a small difference and gap in education, but that does not translate into benefits in occupation. For instance, there is a female disadvantage of 13 percentage points in occupation. If you consider salaried and business, and a 10 percentage point in income. So in terms of healthcare services, we also find some differences. We see like more women use mosquito net and treated mosquito net as compared to men. And then where they consulted when they were sick, we see more women going to government hospital, government arrangement, as opposed to private hospital. And they have to travel actually long distances. And this is because user fee in government hospitals in Uganda, my studies in Uganda, I didn't say user fees in Uganda, they were abolished. So services in government hospital are somehow free, though there are inefficiencies, and most people would prefer to go to private hospital if they have the resources. But we just saw that women have less income, so they have less autonomy. And of course, they can't access services. For my weather variables, I didn't see so much differences except for temperature. And in terms of illnesses, we see over the time period when the study was conducted, of course, the bars are higher for women as compared to men. And in general, more women were ill, like 35% were sick as compared to men, which was only 25.9. And women spent more days of illness, 3.7 as compared to men. Also, women were more unable to work than men due to illness, and they also lost so many work days as compared to men. This is for the overall sample. If you narrow down to the sample that was at least more sick, you find that still the trend continues. So how does, there was a questions about project design, research questions. So my research questions are comparative in nature in order to establish if there are inequalities. And my theoretical framework also acknowledges an economy to be made up of two people, men and women, who are particularly different in adulthood because they can work during this period, they can make decisions and are endowed with different inputs, labor inputs. Some of the income they earn, they can also use it on health improvement. And both men and women invest in health in terms of both goods and time. Of course, we add to this framework other variables such as we model also marriage market and the different healthcare access services and the ecological factors. So how does, still data, we use sex disaggregated data with individual as a unit of analysis. Of course, the survey were asked at a household level, but then for the modules that I use, the roster, the labor force participation, and the health module, they try to ask for all members in the households. For labor participation, I think it was for those who are in the working age category. That's why I was able to narrow down, and because I'm able to control for so many factors also. Analysis I do for overall sample and subsample analysis of men and women subgroups to see if there are differences and how do they compare. And then my results, of course, I quantify the inequalities in health outcome that will have been eliminated. First, I identify the gap, female gap, then I try to quantify the inequalities in health outcomes that would have been eliminated if women were given men coverage or if women and men had access to same resources. Yeah, I do. Yeah, and I can't read the questions there. I hope you can see, but then I think this was challenges in establishing a theoretical framework that incorporates a wide range of gender factors that affect health. Yeah, there are several, I think, theoretical frameworks from the social, from the social side. From economic side, there are not so many frameworks, but again, coming up with a framework that incorporates all this, the social and the quantitative stuff was not easy. Data limitation, given that I used secondary data that has been discussed. Some variables were captured only at individual rather than at household rather than individual. And what I think these are recommendations. Yeah, better understanding of the gender concept and the respective dimension. Yeah, data methods to quantify gender in empirical research, and incorporating both qualitative and quantitative component of gender. I think when I started doing literature review, I think most of the studies that have been done are qualitative, and the stories about gender and health were really nice, and I enjoyed reading them, but writing them was difficult, was difficult for me. So I really wanted to incorporate these two things, but yeah, it was also a bit hard to really understand the other side. Okay, thank you.